Tonight in Medical Rounds, a follow-up to an interview that we first brought you back in September, where we were live at the grand opening of the Hartford Helathcare Inpatient Rehabilitation Unit at Hartford Hospital. And since the opening, dozens of lives have been changed by this new 26-bed unit that specializes in physical, occupational, and speech therapy for patients who have suffered a major illness or an injury. And joining us live now with an update is Dr. Maria Sarujas of the Hartford Hospital Inpatient Rehabilitation Unit. Thanks for joining us tonight, Dr. Sarujas.
Good evening.
Tell us what has happened since the opening and the patients you've helped so far.
Since we opened in October, we've helped over 150 patients regain functional independence and regain quality of life. These are patients who've suffered injury or illness and have had a functional decline. So our team of specialized therapists and nurses and physicians have helped patients transition through their care and go home sooner.
That is so positive to hear. And tell us, how are you doing this? I understand you have some state-of-the-art equipment there and treatments you're using to help patients in the recovery process?
Yes, in addition to the hands-on therapies, we do have technologies in physical, occupational, and speech therapy. Technologies that help with balance and walking, technologies to help with strengthening, coordination, grasp, technologies for voicing and for swallowing, to help these patients who have suffered from strokes or brain injury regain their level of function.
So it sounds like a complete picture when you look at the treatment. And during a stay at this unit, what can patients expect?
Sure, they'll be treated by a specialized team that focuses on rehab, and they will have a private room, as well as the benefit of having a transitional ADL apartment where they can simulate a home setup with a home-style bathroom, a full kitchen. And they do have the benefit of having physicians from the Hartford hospital system seeing patients to augment their care.
That's good to hear. So the bottom line, and we have a few seconds left, this unit helps patients go home sooner, right?
Yes, yes. Our outcomes show that as well. Compared to other hospitals, rehab hospitals in the New England region, we have patients going home sooner and with more functional gains. On average, our length of stay is 12 to 13. However, we have weekly meetings to discuss how patients are progressing and can adjust that timeline accordingly.
That sounds fantastic. Thank you so much, Dr. Sarujas, for joining us again and sharing how this new unit is impacting so many lives.